All right, we're live. Hi, everybody. Glad you're, hope you're able to join us today. Glad if you are here with us. This is the NAAP News Now for the first week in June 2020. And today we're going to talk about, I'm going to be asking Elisa a lot of questions. Elisa Tagg is our operations director for NAAP.
No, I'm the association director. You're the operations director.
I'm the operations director. We're two the same. Good Lord.
We're in the pod. We're the same peas in that little itty bitty pod.
Itty pod. You are the association director, and that's wonderful. It's a new thing. So, but if you are the operations, we can do that too. I mean, come on.
Maybe. Who knows? No.
But what we're going to be asking today is we're going to be breaking down the guidances that have been given down from CMS. And this is really important because there's been a lot of questions coming in to the NAAP office, to the NAAP helpline. A lot of our members are seeking some additional guidance here. And so who better than to nail down for a NAAP News Now than herself, the NAAP News Now host, Elisa Tagg. So we nailed her down for today. And so the first thing I want you to talk about is the difference of the phases. Can you talk a little bit about phase 1, phase 2, and I know we're going to heavily focus on phase 3 because that's where we're all hoping to get to. But can you explain a little bit about those phases?
Yeah, so I just want to preempt this with the fact that doesn't matter what your state's phase is right now, nursing home phases and assisted livings have been included in this. For those of you that are out there in the assisted living environment, you're going to be in separate, your own little world of phases. So that's really important to recognize because I know some states right now, my state, Nevada, we're in phase 2. So now we can have groups of 50 or less with social distancing and all that good stuff. But that doesn't mean the nursing homes can enter into that phase right now. So that is really vitally important that we recognize that the nursing homes and the assisted livings, you're going to be following a separate guideline, so to speak, on how the phases work. So why is because they're concerned about elevated risks with COVID-19 and what's happened with our nursing homes already. You know, that there's the need for this additional criteria to be out there for understanding that. So one of the things I want to point out too is that nursing homes should not advance through any phases of reopening or relax any restrictions until all residents and staff have received a baseline test and the appropriate actions that are being taken by that. So if your community has not started testing, then you're not ready for the phase 1 of reopening. And that's really important too. And, you know, the states are going to survey the nursing homes. So you'll be expecting that to understand, especially those that had experienced a lot of cases of COVID-19 in their communities. They're going to be surveyed prior to reopening and starting any of these phases also. And, you know, we have to really look at maintaining that highest mitigation while the community is in phase 1 of opening up. So in other words, that means that you really have to look at this and understand that you're going to be far behind how your state is opening. Your community has to go through a totally different procedure. So let's talk about that phase 1, because that's probably the one where we're all kind of concerned with what's happening that. And, you know, most facilities may be ready to start phase 1. And that is really important too. So these are the ways that you will have to be ready for stage 1 is you've had to have started that baseline testing and all staff have to be tested weekly. So if you've already started this process and you have 0 positive cases in your building, you're on your way towards phase 1. So phase 1 is going to be a 2-week phase. So what that means is that as you're entering into phase 1, you've started your baseline testing. Now you're testing every week. And now you've gone 2 weeks with 0 positive cases and you have 0 positive cases in your community. So what they're also saying too, though, and this is really nice, even though once you enter into phase 1, visitation is still prohibited, but they are allowing for more through the compassionate care situation. So let me just explain this. I mean, this is completely opposite of what we do. One of my girlfriends, she had a baby, not a baby. She had 2 babies 2 weeks ago. She had twins. And the birth of her twins, you know, she's in the hospital giving birth to her twins. And because her husband left with the babies to go take them to the NICU. They were born premature twins. They were born premature. They were both 6 pounds apiece. Isn't that the funniest part? But they were taken off to the NICU, and because her husband went with the babies, she could not see her babies for 24 hours. They were only allowing one parent per 24-hour time frame to see their children. So her and her husband had to rotate every other day to see their kids. They're still in the hospital. Her children are still in the hospital, but now they're allowing them to come in on the same day, but not together. And so we can see that little by little changes are happening. And that's what's really important too, to recognize and understand that once those compassionate care visitors are allowed to come in, they're going to have to go through the screening process just like you do as an employee. They're going to have temperatures checked, and they're going to be mandated to wear a face cloth covering over their face while they're in your community. And still at this point, there's restricted entry to non-essential personnel. And communal dining can happen during this phase 1, but the patients have to be 6 feet apart. So you have to look at what your dining room situation looks like. How many patients could you have in your dining room at the same time? I would recommend 1 per table, depending on how your tables are established. And that is really important too, to see how that's going to work. Plus, group activities are still restricted, but some activities can be conducted, like going for walks outside, going for walks down the hallway, one-on-one activities. But this has to also be, the resident has to have a face covering on, and they have to be negative for COVID. So you have to really look at all of these things. And of course, for you to even get to phase 1, you can have no COVID cases in your building, okay? So after you've been doing phase 1 for a couple of days, or not a couple of days, a couple of weeks, 14 days minimum, then you can start to consider entering into phase 2. So what happens then with phase 2 after those 14 days, and you've had no rebound cases for the 14 days, and there's no nursing home onset cases, then you can enter into phase 2. One of the things, though, that I want to point out is you also cannot have any staff shortages. So if you have staff that are home isolating or quarantining because they've been exposed to COVID, you can't have any shortages. So if you have enough staff, this will be helpful too for you to start that process. Plus, you have to have an adequate supply of PPE. This is really important to the PPE. And, the adequate testing, like I talked about. When you enter into phase 2, you have to continue testing weekly. So that's the thing. If you haven't started testing yet, you're not ready for phase 1. And so what happens then in phase 2 is there's going to be limited situations where family will be able to come in at this point. It's not going to be just a free-for-all. So I see, Amanda, you're asking that question, how much longer is families? That's what you want to know. It's going to be a little bit longer. So let's go through phase 2 now. So with phase 2, this is the nice thing with phase 2 is you can continue doing the communal dining, and also you can start doing some activities. Okay, this is really important too. Let's talk about that. I want to read it exactly verbatim so everybody understands how the activities will work. Okay, they're going to allow a little bit of entry with non-essential professionals as well. Okay, but they have to go through the same screening process. Plus, they have to wear the face coverings, the face masks as they go through that time. So group activities, including outings, limited for the negative patients only, with no more than 10 people, and social distancing among those residents, and they must wear face masks. So you can start to do group programming of 10 or less with social distancing precautions in place, including going on outings into your community, but your residents must wear a face covering the entire time. Okay, this is vitally important. So even if they have like appointments with the doctors, they can start now going out to appointments at the doctor's office, but they have to wear the face mask. And there must be 100% of screenings of all the persons that enter the facility and all staff at each shift. Temperature checks. Outside persons that are entering the building must have the face covering on. And then the questionnaires that you've already all hopefully been starting to fill out as you've started the testing process, and 100% screening at least daily for all residents as well. So that includes temperature checks as well. And that's really important that you understand how that works. So then how do we get to phase 3? Because I know that's the big question. So in order for you to exit phase 2 and enter into phase 3, you must have completed phase 2 for 28 days. That's right. An entire month, 4 weeks. So now we're about 6 to 8 weeks into the future. So again, if you haven't started testing, you need to start testing now so that you can start this process. Okay, so when we do enter into phase 3, the community, there's no cases of COVID still, right? And you've gone through phase 2 for the 28 days. There's no staffing shortages. The nursing home has adequate supplies and has adequate testing for COVID-19. When you get to that phase, which I'm going to guess for most communities, this will be the end of August, the beginning of September, then visitation will be allowed with screening and additional precautions, ensuring that social distancing is happening. I've talked about the face mask all the time. I did not mention hand washing. I feel like that's already vitally known, but if not, hand washing. So you'll have to have hand washing stations at your entry area as well. As long as you're also offering all of that, then communal dining is limited still, but residents may eat in the same room with social distancing, but they still have to be 6 feet apart. So however big your dining area is, however many residents you can accommodate in that dining area is what you're limited to. Also, with group activities, there are no restrictions on how many residents, but you are limited to the social distancing aspects as well. So if you have a very large activity room and you can accommodate multiple people with the safe distancing practices in place, you can start to do free group activities at that point. Also, again, hand washing and face masks are a requirement at phase 3. This is really important that you recognize and understand how that happens. Also, in phase 3, this is the nice thing, volunteers are allowed to start coming in again. They will have to be screened at that time. Also, contracted employees. So this could be your entertainers could start coming again with proper screening. But any trips that take the residents outside of the building, so this includes our outings, the resident must wear a mask. And the facility must share the COVID-19 status with whoever the transportation services is. So if you're not using your own bus system, you have to let them know. And 100% screening must take place at all times, and daily checks again of the residents. So this is really important information that we are still providing quality things. So what I want to talk about then is that the nursing homes are still required to continue to follow CMS and the CDC guidance. And this is so just let's recap it all. In order for you to get to phase 3, there's been no new nursing home onset cases for 28 days. So through phases 1 and phases 2. So the nursing home is not experiencing any staffing shortages. The nursing home has adequate supplies of personal protective equipment and essential cleaning and disinfectant supplies to care for residents. And the nursing homes have adequate access to testing, and the referral hospitals have bed capacities on wards and intensive care units. So as you can see, it's going to be a little bit of time before we get to enjoy having full visitors again.
Yeah. There's so much back behind that. Can you talk a little bit about, in your mind or in your opinion, the differentiation between the outing and the medically necessary trips? I'm assuming they're the same as far as the guidelines, but then why do we call them medically necessary trips when we're going to allow outings?
Yeah, because the medically necessary trip would be to go to a doctor's office if they needed to have dental work done or their glasses. You know, I have a bunch of residents that were being fitted for glasses before this happened, and then they never got their glasses. And so here we are now 2.5 months in. So that would be what would be allowed, you know, and a lot of the eye optometry places closed anyway. So now that would be allowed for them to be able to go pick up their glasses. That's a medically necessary appointment. outings would be to go to Walmart to shop. If you used to take your residents to Walmart to shop. Other things that would be involved with that is also the importance of ensuring that the residents are kept safe. So if your bus is small, you may be limited to only taking 1 or 2 residents at a time anyway.
And we have this question here from Trisha. When do they talk about hair salons specifically? I mean, that would be that outside contractor or visitor, correct? So that would be phase 3.
Right. So phase 3 is when outside contractors can start coming in. Yeah, Trisha, that's a great question. My day job is working as an activity consultant. I'm an independent contracted consultant. I have 4 buildings that I was currently working in March. I'm still working in them, but I'm not allowed to physically go into their buildings. So I've been doing everything via the internet. Thankful. That's the good thing about having electronic health record is I'm still able to do the audits that I need to do. I'm still able to visit with the activity directors via, online, via online, and I'm able to communicate with them, telephone, text message, whatever. But I would not be allowed to return to the community until this phase 3 either. And I know the nice thing is Trisha, you could look at this. Is it medically necessary that the resident get their hair done? Phase 2 is when they could start going into the communities for outings. So we could, you could look at a local hair salon where you could take a couple of residents to get their hair done at the hair salon. Now, a lot of the cosmetology hair salon places I know in my state, when I went to finally go get my hair done after 12 weeks, I had to wear a face mask in my salon. So I had to sit in the chair with a face mask on while my beautician did my hair. And then I also had to go home and let the color process because they weren't allowed to use any kind of blow dryers or anything like that. So it is a good thing, that we're kind of waiting for this. So the really essential thing that I can't express more is how vitally important it is that you start doing testing weekly. I'd like to ask, I know we have a few on here today, if you wouldn't mind just typing, in the chat area there, have you started weekly testing? That would be a good question because I've heard from many communications how vitally important that is, but it's not happening yet because of funding, because of getting the test happening, and that's the key thing there. You're right, Trisha. It is riskier, but that is what the information is about. That's a good point, Trisha. Very good point. And so let's just talk about that because that's really important. Testing. Good. Heidi, New York, testing has been happening weekly. And I know Heidi, New York just started phase 1 yesterday, right? Okay, good. Carmela says testing weekly, and this will be your 3rd week. So if, Carmela, you've had no positive cases during those 3 weeks, you're ready for phase 1. And that's the key right there is that every building is going to be different. And that is so important. We can't follow one rule or one guideline that every building is going to be different because testing has to happen. All staff should be tested weekly. All residents should be tested upon identification of individuals with symptoms, plus weekly testing occurs until all residents test negative. So Carmela, I would recommend you talk with your administrator and say, hey, we've been 3 weeks. We have 0 COVID cases. Let's start this phase 1. Let's get going. That's really important too, because we are seeing communities starting to reopen because they are doing the testing. And that is really a key thing too.
And I think it's important to point out, not just buildings being different, but the state that you're living in is going to have a huge impact on how quickly these things happen. Would you agree?
Oh, yeah. Yeah. Yeah, it's just going to depend. Like, I know, like, our bigger states that are wide open, like Montana and Wyoming, that have had pretty much essentially no cases of COVID, they've already started that process. I know just in our state, if you're not familiar, I live in Las Vegas. Vanessa lives in Reno. And if you're not familiar with the state of Nevada, we're about 8 hours of nothingness between the two of us, And Las Vegas has had a plethora of cases where Reno has had very minuscule cases. And so, Reno opening more quicker than Las Vegas, even though we're on, we're on the same state. Our governor has allowed us to, now we're in phase 2. as the state is concerned, where we can meet in groups of 50 or less. And now we can sit down in a restaurant with social distancing. But that doesn't mean our nursing homes are ready for that either, because we see a lot of positive cases in Southern Nevada in our nursing homes. Yeah. Yes, right. Dee, you have to go weekly now that you've had your baseline test. So Dee asks, that question, and you have to start now testing weekly. So once you get to that point where you can enter into phase 3, visitation will be allowed again with a few caveats. I just want to talk about this. Visitation will be allowed with screening, ensuring social distancing is maintained, hand hygiene is being performed, and visitors must wear a mask or a face cloth covering. So what else? Personnel contractors. This is your beauticians, your consultants, non-essential healthcare personnel and contractors are allowed in phase 3 to enter the facility again with one caveat. The facility needs to have a plan in place for determining which non-essential personnel are determined to be necessary. So that was really important too. So facilities are going to need to also ensure that these non-essential personnel and contractors are screened as well and take additional precautions like all the other visitors. And they must maintain the social distance, perform the hand hygiene, and wear the face masks and the cloth or the face covering. So this is really funny because you think about that for a minute. How can a beautician come in and socially distance themselves, from doing a person's hair? Well, that's the key. They understand what the beautician's role is. And that's the other thing, you have to look at your contracted beauticians and see if they are prepared to do hair. Are they willing to come into your building and return and do their job once again too? And with volunteers then, they'll be also allowed into the building, but they must be screened too and take additional precautions. And these precautions are the same for other visitors and non-essential personnel, maintaining the social distancing, performance hand hygiene, and wearing that face mask. So these key things are just really important to understand as we get to this point. Yay, we're getting closer to being able to reopen our communities.
We're inching along, right?
Yes, we are. We are.
And so where, I replied to Diana here, but, where to get this? We, of course, have it up on our site, but this information is readily available if you want to talk a little bit about that.
Absolutely. CMS.gov. This is your number one resource right now. They have been wonderful. I've had the opportunity in the last month, we've entered into June now, in the month of May with my new role as the association director, I've been sitting on a lot of calls with CMS, a lot of phone calls that are really, some points not very good and some points very good information. And what I've really enjoyed about that is they are huge about ensuring the safety of our residents. They know this is a very precarious time for them because we have seen what was it, like 40% of all deaths were nursing home patients. So this is troubling. Yeah. And this is kind of a scary time. And we know that's because of how communities work. And so there are all kinds of organizations now, Pioneer Network and Leading Age, both released information on the new models of care that may have to come out of this. So if you have like roommates, that's probably going to be, looked at as going away. That's going to be a vital thing too. One more thing that I want to touch base on is surveys, because that was actually asked of me personally. What's the survey process now when this happens? So I don't know, Vanessa, if you had that one planned to ask me or not, but
I did because a lot of people have been saying it's expect the unexpected. Is this going to go back to the normal, what we're used to when we look at our survey processes? How is this going to look?
Yeah. So what happens is then when a community enters into phase 1, obviously the nursing homes need to remain at their highest level of vigilance and mitigation. And nursing homes do not begin to de-escalate or relax restrictions until their surrounding communities are satisfied in the gathering criteria. So you will still continue, if you haven't already been, I know that was like, what? If you haven't already been surveyed for infection control from your state surveyors, you should have been. And what they will do is they're going to continue to provide that survey. So you will continue to be surveyed via infection control. okay, then you have to spend a minimum of 14 days in each phase, as we talked about. So every facility will be maybe in different phases. But what's going to happen too is that the state survey prioritization will start again during phase 2. Okay. What that means though is what they'll come and survey with is investigating any kind of complaints. Mm-hmm. And I'm sure we'll have high complaints. You know, families are going to be very upset. They're going to be looking at abuse and neglect, infection control, insufficient staffing, or other quality of care issues. Then what they're looking at, if you are ready for your standard recertification survey, they will focus on those facilities, though, that have a significant amount of positive cases. And they will also look at the different things. But when we get to like phase 3, that's when the surveys will happen again. So if facilities are overdue for their standard survey, so what happens then, and if they have not a history of non-compliance at the harm level, maybe you've received a G citation or above, you will be one of the top facilities they'll come in and survey. So that is really important too. So if you had a last standard survey was 24 months ago and you were cited for abuse at the G level, you're going to be surveyed right away. Okay, so that is the key thing to do as well. So surveys won't happen. Your normal standard surveys will not happen again until phase 3 as well, because again, a surveyor would be deemed a non-essential person. So they're not going to have you come in unless they're seeing like problems in your community. Then they're going to come in more regularly. And I see, Tricia, you just wrote it that you just had your survey for the infection control today. So that's good. So then they'll be doing periodic ones. That won't be weekly. But it will be priority of that. Diane, great question too. They're popping up. Thanks, Vanessa, for popping those up. It's screening only. I believe I told you differently previously, and I apologize for that. But as I've reread over these multiple times, it's screening only for volunteers, which I find really confusing. And that's why I probably told you something differently, Diane, is because the volunteers are required to be treated just like employees according to our regulations. But they're not requiring you to test them weekly like employees are being tested weekly. But that may change. You know, your facility may want to do that, especially if you have volunteers that come in every week. It may be a good idea to have them tested weekly. Yeah, Cindy, I hear you. I really think they're going to be looking at more of how the community has coped with everything. Documentation is key, yes. I tell this all the time. If you didn't do it, if you didn't document it, you didn't do it. And so, yeah, but I believe too that they're going to be understanding of the situation as well.
And you know, just to throw it out there, this doesn't really have much to do with survey, but this morning I was talking with our webinar speaker. We had Michelle Olson doing our webinar this morning. We were talking beforehand and just about kind of the unprecedentedness of this, the craziness, the chaos. And she said a point that made so much sense that I really haven't heard anyone else say. I'm sure they've all thought it, or maybe someone said it, but no one has said it to me or to you. I don't know. But like next time we have a noro outbreak, next time we have a flu outbreak, it's going to be like, we know exactly what to do. We have all these systems set up. No one's going to miss out on anything. There really is no more isolation because we can now get into their rooms, the technology, the this, the that. Has this really prepared us for, like you said earlier, a whole new service model? Is this going to change activities forever in the way that we, you know, even myself as a consultant and working with, I have 5 buildings here in the north, and it's like, I'm excited for you guys to go back to these, you know, the practices we were doing before, but I want you to keep half of this like you were, you know, and like half of those things you were doing to stay that way because you were reaching so many more people. And I'm seeing that through my reviews and my audits, that residents who weren't being very active and weren't engaging with staff, now that everything's coming to their room, they're really being able to engage and enjoy that. So, so kind of an interesting point.
Yeah, you know, it is. And you know, if you ask me that question, I would say no. We're never going to go back to the way it was before because this is the new, and I didn't even like the term. I hate new normal, and I'm not going to say new normal. I'm going to say this is what we're doing now. And I think we can learn a lot from the technology of what we're doing now. And we've seen how the benefits of the technology have worked. Yes, we're going to have residents that are going to need to be in that group programs again, and we're going to provide that. But we also can't lose sight of those residents that prefer to have technology done in their room. Just like before. Before this all happened, we had a variety of residents. And what we were seeing with the trends with nursing home surveys and deficiencies in activity specific was that sampled one of the 25 or 29 residents could not be catered to because we were so focused on the group programs all the time, we were failing to remember the one-on-one programs. And that's the vital thing that we need to look at and understand is how important one-on-one programming is and how important individualized programming is. Hello, our regulations say that. Provide individualized programming to cater to the needs of the one. And I really think this is a huge shout out to activity professionals on how amazing you are all doing. And we are going to see the profession of the activity professional rise even higher than before, because you've all amazed me. I have loved seeing everything each of one of you have been doing on our social media pages, the carts. Oh my gosh, that they're extravagant. And I know that it's bringing joy and love, and even the little things you're doing, just the little things you're doing to ensure that the needs of your residents are being met. Extraordinary. Everybody's just doing awesome. And
keep doing that.
Yeah.
When we go through these three.
Yeah. So I'm just seeing some of the comments here. Donna, no entertainers till phase 3. Lexi, I'm sorry, but you're going to have to start doing that in order to enter into phase 1, because that's what the mandate says. So hopefully you can go back, tell your facility, people, we need to get on this. You need the paperwork to back it up. It's on cms.gov. We actually have exact links to all this information on our website as well under our COVID-19 resources page. So if it's easier to find it there, go there and grab it. Print it out. Take it to your administrator. Say, this is what we've got to do in order to get to this next phase.
Yeah.
Totally.
Well, this was a lot of information, Elisa. Thank you. I knew you were the right person to ask to do this. And I took over your hosting duties for this week. I'll be doing it next week.
Yeah, I'll be back.
Who you have next week?
Yeah, so I'm very excited because next week we're going to be talking with Coral Health. And we've got some great individuals that are going to be talking to us about their services and their products. And it'll be really cool to learn a little bit more about them. And then the following week, we will have the Senior Entertainment Network will be with us to talk a little bit more about what they're doing and what they're providing. And then, we're going to take a couple weeks off and we'll return back in July to go on with the next subject. So hopefully this has been helpful information to you to be able to start the process so you can get your communities reopened as well.
Yeah, thanks a lot for the information. And to know what's happening with NAAP News now, we do put notices out in our news, in our Monday emails that go out. You can always find it here on our Facebook page. If you guys have suggestions of what you'd like to see talked about live on NAAP News Now, shoot us an email or put it on here, and we'll do our very best to meet that need and to try to get speakers. So that's wonderful. All of you guys, thanks for joining us. We're live. We can go. We've established whose association, whose operations. It's been a heck of a Tuesday. It's been a heck of a Tuesday.
That's why I started straightening my hair more so that we don't get, misidentified anymore.
We get misidentified quite a bit. So
well, our names are similar too. And the beauty of it, I think you're the cat's meow, Vanessa. You've been a good friend of mine for many years, since 2005, 15 years now that when we first met. Hi, Renee. And it's just been so fun to work with you on all these different levels. I'm blessed. You're a great gal.
I couldn't have said it any better. And there was no one better to ask all this compliance stuff than you. So I'm glad that no one was bored with it, at least. Everyone was excited to get the information. Go to our website. You can see the link in here. You got the link for CMS. We've got all these resources. I encourage you to go on the website too and look at Coro Health before they talk next week. Okay.
Yeah. We had one final question. Glenda, great question. So we are happy to say that NAAP did extend our webinars. Our free live webinars are now valid through July 31st. So you have this month and July to take advantage of that. We had one this morning, the one that Vanessa talked about with mindfulness journaling. We have another one on Thursday. We actually have one every Tuesday and Thursday this month, except for Tuesday, June 23rd, because we will be participating in the Activities Strong webinar summit that Link Senior is doing. So we encourage you to register for that too.
We do have one on a Monday.
Oh,
Linda Redhead is doing a Monday, so I believe that's June 15th. So
awesome, Linda.
Website, yes, absolutely. Get all that information. Soak up all these credits as you can. What we've realized for all of you, part of this was to help, those that were needing to renew and this time crunch because we had to cancel our conference. Mm-hmm. When July is over, we will have offered almost double. I say almost triple, but double of what anyone would have gotten at the conference, and certainly what that kind of baseline requirement is for certification renewal. So you can have obtained all of your credits through our service in the last 2 months, going on 3 months. So that's pretty phenomenal.
I can tell you, I attended so many webinars myself in the month of May. I think I got 25 hours, and I need 40 as a consultant, but I'm like, and I just renewed. So I'm like, I'm all set. But,
right.
But I'm also one about education. If you didn't read my article about education that's on the NAAP website, because I think education is vital. Usually when I go to renew, I have 70 hours, 80 hours of education because I find it's such a valuable resource that we should all be tapping into.
Absolutely. So absolutely. All right. Tricia, there's nothing for today. You just got to talk to us and interact live. Thursday you can come and join us on Thursday. We're doing our webinars Turn On Wellness, and that's with the people from Spiral 100, and they were going to be at our conference. We're really excited to get that information from them.
Yeah, great resource, Spiral 100. Yeah. I wish I'd known about them sooner. They're awesome. If you're not using them, I encourage you to register for that webinar and learn more. Totally.
Absolutely. Elisa, thanks so much for your time. Everyone,
you're welcome.
Have a blessed rest of your week. Stay safe, stay healthy, and we'll see you next Tuesday live. You won't see me, but you'll see Elisa next Tuesday. All right. Take care, everyone. Bye-bye.